I guess we should probably define what is breast implant illness.
Chronic inflammation exists with or without implants. Most of my patients show up with a laundry list of chronic inflammatory symptoms from head to toe. So neurologically, they can have brain fog, they can have headache, they can have light sensitivity, sound sensitivity in the whole ear, nose, and throat system, dry eyes, cough, sinusitis, chronic stuff that has no answers, heart palpitations, chest pain, shortness of breath, nerve pain in their extremities, tremors, and then the gut is just wildly abnormal, like everything.
That's interesting that you say the gut. I don't think I would have ever thought that gut problems could be caused by breast implants.
When I look at this, I think it's chronic inflammation, and the breast implant is playing a component. When I look at testing for it, I look at your functional genetics. So we're very big on understanding how you detoxify. So everybody has a set of genes from mom and dad, and those genes dictate how you detoxify. Now, if someone has heard of all the fancy people on podcasts who talk about the MTHFR gene,
Yes.
and how wildly expensive they've made testing for this, which is a joke. So I'll let you know. We have a company we use that tests for over 250 genes for like $900, but some people are charging $600 for 5 genes, including MTHFR, which is just ridiculous. So that's part of your methylation path.
And if you have the MTHFR gene, are you more susceptible to breast implant illness, you think?
We're in a room right now with everybody doing this show. There's 5 people. Half of us will have that gene. That is one player. And then how we metabolize vitamin D and absorb it and transport it. How we, everybody may or may not have heard of something called glutathione, which is an antioxidant. They use it for beauty a lot. They're like, oh, get your glutathione, push IV at this, the place. So we use liposomal glutathione as part of our inflammation support bundle. But the point is that substance is incredibly important to bind up and detoxify things in your liver.
Okay.
So when you have limitations in vitamin D metabolism, methylation, how you metabolize glutathione, and then your antioxidant pathway. Everybody remembers antioxidants like vitamin C. All right. So if we have limitations genetically in antioxidant pathways in our cells, we'll have a buildup of products that makes us more and more fatigued. You can just imagine like my client is that person who has 3 or 4 of those problems.